I'm Christina Owen, the Student Services Specialist for the Bakken Center for Spirituality and Healing. And my purpose for today's webinar is to help moderate the chat and facilitate the Q&A at the end of the presentation. So without further ado, I'll turn it over to our Coaching Program Director, Dr. Cherie O'Neill.
Thanks, Christina. Hi, welcome in everyone. We're so happy you carved out some space and time to be here today. I know it's not easy to do these things on the side. I'm super proud of Christina and I because we matched today. We look good. I'm just kidding. All right, so welcome in everyone. I'm going to start just getting set up here for real quick. But I am the director of the Integrative Health and Wellbeing Coaching programs, both our certificate program and our Master of Arts in health coaching. So I been in the position for about 3 years and super excited to start our spring semester coming soon. All right, let me get the presentation going. All right, beautiful. My little thing at the bottom disappeared. Hang on. All right. My presenter view disappeared. Give me one sec. Oh, I see it. Beautiful. Okay, so let's get started. Before we dive in, I just want to share this quote with you all. Think of how hard it is to change yourself. Now try to change someone else. It's an odd one to share, I know, because of what coaching is, but there's kind of a little backstory here. When I was in high school, I had a teacher, he taught our psychology class, and every day I would chat him up just because I was super interested in psychology at the time and, 16 and really naive. And we would talk after class a lot about why people don't change their behavior. And I often ask questions about smoking because at the time I had family members that smoked. I was like, I don't understand. They know it's so bad for them. They know they're going to get cancer. Why don't they just quit? I don't get it. And he said this to me, think of how hard it is to change yourself. Now try to change someone else. And at the time, I'm not sure I fully understood what he was getting at. But once I got more and more involved in academe and degrees and learning about behavior change, I realized, oh, what he was talking about was that behavior change is actually one of the hardest things you'll ever do in your life. And it has to come from you and not someone else. It has to come from internal. And that has just always stuck with me. And I think that represents health coaching really nice in a nice little bow. So we'll start off with what is a health coaching, just because I don't know where everyone is coming in at in terms of their knowledge, skills, abilities. So we'll just start with the basic definition that is on the National Board of Health and Wellness Coaching's website. It is quite lengthy, but it does represent all that we stand for, our beliefs, and what we are experts in and what we are not experts in. But I also have my own definition, just easier to remember. I have struggle remembering this big one, so bear with me. But health and wellness coaches co-create a space to practice making behavior and mindset changes in a non-judgmental environment. So that's my short, condensed version of this large definition you can find on their website. So one thing, getting clicky happy. You'll get the slides after this session, and there's just one thing I really want to point out here. This link goes to a YouTube video of a coaching session. This is just one example. It is lengthy. I'm not saying watch the whole thing, but if you have never participated in health coaching, don't know a lot about it, have never seen an actual coaching session, I want to strongly encourage you to watch some of this, especially from the beginning, at least get in about 15 minutes. It's really important before, making such a big decision about going to graduate school and perhaps getting a certificate or a degree, that you understand sort of what you're getting into and what one really looks like. And ideally, if you have the wherewithal to participate in hiring a health coach, that would be ideal as well, or getting referred to one by your provider. Okay, so what does a health coach do? Health coaches help people improve health and wellness behaviors and mindsets. That's sort of, intuitive, but there are a lot of other things we do that maybe not as intuitive. We co-create the partnership and safe space of non-judgment and unconditional positive regard. We facilitate achievement of client goals. We help keep the focus and maintain curiosity. We consider a person already whole and, oh, geez, I keep clicking. Consider a person already whole and capable. And that's sort of what is meant by unconditional positive regard. We don't view folks coming to us for health coaching because they're broken and need to be fixed. That's not the premise we take from a health coaching perspective. We believe you're already whole, capable, and you have the answers within yourselves. You just need someone to sort of brainstorm with, talk it through, perhaps ask you challenging questions and supportive questions to help you work through the complexity of any life decision or mindset or behavior change. Because as I said before, it is one of the hardest things you'll likely do in your life is change I would even argue change a health behavior. This tends to be even harder. So what does a health coach not do? A health coach does not give advice. And I know this sounds like, oh yeah, I get it, I get it. But until you get into a coaching session, it's really hard to understand what we mean by not give advice. We literally will not tell you what to do ever. And some people get frustrated with that right away, but you end up figuring out that you really truly have the answers inside you. It's just having that partner to figure out what works best for you. So we definitely don't drive the process. We don't like set your goals for you or we decide the goals for you. It's really about you in the driver's seat. And we don't judge your process, your timeline, how long it takes you. We don't judge whether you met the goals you set for yourself that week or not. It's really irrelevant. The coaching process allows us to be your thinking partner. And that's really our goal, is to be your thinking partner and not make sure you meet goals or don't meet goals for whatever reason. That's more you driving that piece of the process. So before I get into the curriculum, I just wanted to briefly talk about some perhaps misinformation that's out there about health coaching. So when you read articles online or perhaps even journal articles, I would argue most of the explanations of health coaching fall above the water, the part we can all see, which is health coaches helping people change behaviors, or I would argue mindsets, which is way down here. So when we talk about health coaches, we generally think about the behaviors you can see and hear. But really, as you can see, the water is the largest portion of what we do. And that's really what's below the surface that most people don't see, which I alluded to earlier. It's the structures, the systems that are in place that really decide what behaviors we're going to do and how we're going to do them. And the biggest chunk of the puzzle is the mindsets, or the biggest chunk of the iceberg is the mindsets piece. So how we view the world, how we think about it, how we think about possibilities, and how we think about ourselves, and that self-processing that happens. So really, the bulk of our work is here, but most people just reference the behaviors they can see in here. So I just wanted to kind of frame that before we get into the curriculum. So there's lots of areas you can focus on in health coaching. Man, it's a free-for-all right now. I'll just say that. Chronic disease, stress management, you can focus on sleep, life transitions, seniors, general health and wellness, personal growth and development, new moms, executives, physicians, burnout, all that really good stuff. And this is because we can focus on these areas because we can get additional education to bring in this focus. But the reason why we can expand in this way is because we're experts in behavior change. We're not experts in any one life transition, any one chronic disease, any one clinical condition. We are experts in the process of change. So when you have that as your baseline, then you can start to pull in the niches with additional education. Whoops. So where our graduates are currently working from our program in particular, we do survey them. Most are in these areas here: corporate wellness, education, family practice. Of course, health insurance is the primary employer right now. Employee benefits as well, private practice, integrative health, which is our love and our bread and butter, and senior living and fitness and wellness centers. So when we talk about the pay of health coaches, there was a recent industry survey that went out, published, really recent. I put the citation at the bottom of the slide there for you, but coaches with a master's degree or higher reported earning $39 per hour more than coaches with a bachelor's degree. So the payoff of the master's seems to be working in terms of the financial benefits. And then coaches who manage other coaches are 3.95 times more likely to make $50,000 per year. All right, so I just said this and I'm going to say it again before we get into the curriculum. I'm just briefly, and then I promise it's next. The history of health coaching and our program. So it's important to understand where you're going to school, how long the program has been involved in the field, and where did this all start. So just quickly, the formation of the National Board of Health and Wellness Coaching happened in 2010, and we were founding members of that formation of that board. My predecessor, Karen Lawson, is the co-founder of the National Board of Health and Wellness Coaching. So we have been in it from the start, and within the NBHWC leadership from the start, and really foundational members in our contributions as well. It's also important to note that the NBHWC came about through the partnership with the American Medical Association and the National Board of Medical Examiners. The board is actually a subsidiary of the NBME, and that's the organization that writes and produces the exam that physicians take in order to become an MD. So real legit, a really profound organization, and we are large partners with the American Medical Association. So this was the foundation and the history of kind of health coaching in the United States so far. It was in 2005. So if you'll notice, way before the board was even founded, we launched our post-baccalaureate certificate program. So we were way ahead of the game in terms of the value we saw in health coaching and where we saw it going in the future. Of course, I was not here at that time. I'm not taking credit, but it just shows you like how we've been in it from the start and leading the way. And then our Master of Arts program was launched in fall 2014, and we are very proud to say we were the first master's program in the United States. And of course, all our programs are the National Board of Health and Wellness Coaching approved programs are accredited, meaning either program that you go through, at the end of the program, you are eligible to sit to become a nationally board certified health and wellness coach. So you have to go through these accredited programs in order to sit for that exam and get the credential. Okay, so future of health coaching is looking very bright. The Centers for Medicaid and Medicare Services in January 2024 announced codes, reimbursement codes for health coaches. They have not been implemented yet, but the codes are available for research right now. And where it's kind of getting hung up is they're deciding the reimbursement rates, and that can take some time because it's based on 12 different regions. So it's kind of held up there, but it gives you a sense of where it's going, and we're expecting to see reimbursement codes at least starting in primary care very soon, which if you just think about a new service line in healthcare is kind of almost unheard of these days. And a new service line with new codes for reimbursement is a pretty big deal. So we would expect to see pretty high increase in job opportunity within the next 5 years. And then, of course, more of a focus for our program will high need for future leaders, especially in healthcare as these codes get released. And then, of course, digital health coaching is exploding. If you haven't noticed, I'm sure it's been in your social media feed, everything from new mom coaching to GLP-1 coaching to Noom coaching to the gamut. I'm sure you've seen them all. So lots of opportunity there. Our program philosophy is a three-legged stool. So here's where we're getting into the curriculum. We have three P's, the personal, the professional, and the performance. So I'm just going to take you through the personal. Our program philosophy around the personal and the curriculum really focuses on personal transformation and the coaching spirit. Mindfulness and emotional intelligence is the foundation of all coaching. And so we really focus on your personal development of these two skills. And these are skills, mindfulness and emotional intelligence, as well as attributes. And then our commitment to diversity, equity, inclusion, and belonging is also a big portion of your personal development within the curriculum and within the on-sites, which I'll talk about in a minute. Next is the professional. Of course, we want to always elevate our discipline whenever we can. So there's a focus on leadership. Of course, we are in the Center for Spirituality and Healing, and we love integrative health. So we are training you within the umbrella of integrative health. And we also, within our professional domain, have a strong commitment to social justice and evidence-based decision-making. So that's where we're pulling in the research and the efficacy of health coaching and beyond. And the last P, the performance. This is what gets students a little bit more nervous, but we are really focused on performance, meaning your ability to health coach. And so there are plenty of opportunities. We have a practicum, we have an internship, which is really rare in this space right now. We have a course in trauma-informed care and mental health, and what does that mean for health coaches, and how do we stay within our scope of practice? And then we, from the start, have had this group coaching class. We do believe it is the future of health coaching is group coaching. And so that also includes a practicum experience. Lots of fun, lots of opportunities to health coach. Okay, so here is I'm going to start with the Master of Arts program. It's a 30 credit 2-year degree, as you can see here. In the fall, you'll take 8 credits. So we start with a nice intro class about whole health models and integrative health and what that looks like. That's the sort of the umbrella we operate under. So it's good to have that foundation. And then we get into the basics of health coaching. So the introduction to health coaching is really about learning motivational interviewing at a really in-depth level. It's the real focus of the course. And then, of course, we need our health behavior change theory and applications around how does health behavior change theory show up in your coaching sessions. So understanding the theory is super important. And then when we move on to the spring, we take health coaching 2. So we're learning to advance our skills within the health coaching domain. And then also take a course within intersectional perspectives in DEI, mental health, and trauma-informed care. So this is where we're really getting at what does trauma-informed care look like? What does mental health look like within the scope of health coaching? And how does diversity, equity, and inclusion show up in your coaching and how you interact with your clients or the groups that you'll be working with? And lastly is our practicum. It's 1 credit where we have you coaching actual clients and putting everything you've learned into the coaching session and assessing your skills in that area. In year 2, we look at whole person health and clinical conditions. Because you don't need a health background to apply to this program, it's really important that we give you the foundation of what clinical conditions are, what chronic diseases you're most likely going to work with as a health coach, if you go that route. And then is the group coaching class I mentioned earlier, 2 credit class with the practicum included. And lastly, for this fall semester is leadership and evidence-based decision-making. The Master of Arts program in health coaching is a leadership program, and we're really focused on helping that next generation take over the discipline with the leadership skills they need, especially in evidence-based decision-making. What's the efficacy of health coaching? Implementation science is really important to health coaching, and making sure we adhere to the principles that we are bound to within scope of practice. All right, last semester, you're almost there. It's, of course, your internship where you will coach, individuals within this 3 credit course and do a capstone. And then you'll take a Principles of Management course from our very famous Masters of Public Health program. Great course to get you those management skills we're going to be looking for in future leaders within health coaching. And then you have an opportunity for a 3 credit elective within the center. And I'll give you some examples of options in just a minute for those electives. Okay, so the certificate program, this program, oh, you know what? I'm going to go back real quick. I forget to say this every time. If you are already nationally board certified health and wellness coach, you do not need to take 5701. You can take something else instead, because you do need the minimum of 30 credits to get a degree from the University of Minnesota, but you can replace that with something else because you're already certified. So even this program is even for those that are already certified. As I said earlier, it's a leadership program, so it makes sense that it's not just for folks that are looking to become a health coach. You don't need a master's to be a health coach, right? So just wanted to clarify that. Our post-baccalaureate certificate in integrative therapies, the health coaching track, is 1 year, meaning a fall semester and a spring semester. It's 16 credits, and it is the first year of the master's program. So again, exact same courses. You're with the master's students the whole time. You're just following just the 1-year track, and you would not go into the second year. So you get the same practicum experience and the same instruction in health coaching and health coaching 2. And then, of course, the trauma-informed care DEI competencies as well. I won't read these just to just due to time and making sure we get all your questions answered, but this is available on our website. You'll notice the MA program outcomes focus more on leadership management, evidence-based decision making, which is that whole second year, along with, of course, all the health coaching competencies and our DEI competencies. But just kind of pointing out overall, the big differences are that the MA program outcomes are more leadership-based and evidence-based decision making. And then the certificate program outcomes are more focused on, of course, understanding mindfulness and emotional intelligence and integrating health and well-being within your coaching practice and learning the basics of behavior change and health coaching strategies. Okay, so let's talk time commitment, the most important thing probably for all those considering. So the University of Minnesota has a general guideline for all graduate courses. So that is this first bullet here. 1 credit equals 3 hours outside of classroom time. Classroom time is usually about 2 hours a week per course. And so you're looking at 3 hours outside of that classroom time. So for a 3 credit course, it's 9 to 10 hours per week outside of classroom time. You can estimate for in terms of the workload within these courses. We do have an on-site weekend requirement in the first year. This cannot be waived for any reason. So you do have to come to the Twin Cities twice total if you're in the master's program or the certificate program. It's only twice, once in the fall and once in the spring in year one, if either if you're in the master's or certificate program. And for the fall 2025, the dates are September 12th and 13th, and we'll have the dates for spring very soon. So we always let you know almost 8 months ahead of time so you can plan accordingly, but it is a weekend setup, 8 to 5 both days. And then, of course, we hope you'll come back on site if you don't live in the area for graduation, which is always in May every year. That's our hope. Not everyone can make it back depending on how far you live, but that I like to throw that in as please come back for that round as well. All right, so other considerations. I really tried to sit down and think about if I was choosing a graduate program, what would I really want to consider now that I have hindsight, right? I wish I would have known this before I chose graduate programs, although I did love my programs. So something to consider is the program you're looking at a research university. So that usually means in plain speak, Big Ten school or a Research One university is usually the flagship schools in states. And why you're kind of considering that is research universities tend to be more exposed, the faculty and the curriculum tend to be more exposed to cutting edge changes that are happening within your discipline because these are the folks that are running the studies and doing the science behind these cutting edge changes. So if that's important to you, that's something to consider. Looking at the faculty, how involved they are in the discipline. Are they sitting on these board committees? Do they look like they would be good mentors? Are they connected within the field? Can they help you make those connections? This is really important in graduate school in particular, not so much in undergrad, but it's something to really consider in terms of what's the background of all the faculty. What are the campus resources, especially if you're looking at online programs or hybrid programs? What are your opportunities to be involved beyond just the program? Obviously, those things matter as well in terms of networking and building your skills and abilities. And then I'll leave banded tuition, Christina, I'll have you talk about that. But other things to consider is what are the other opportunities in terms of minors? Can you do study abroad? Are there other certifications you can get while you're in the program to make yourself extremely more marketable once you get out? Do they have yoga certifications? Yes, we do. We have Reiki certifications, things that you can get while you're in school and not pay for, which Christina will explain. And then the electives I mentioned, I would talk about you. So you get a choice of a 3 credit elective within the program. And this is just some examples. We have lots of mindfulness classes, mind-body integration, cultural healing approaches, Tibetan medicine, nature-based therapies, a lot of courses on resilience, purpose, things of that nature. So, so much cool stuff to choose from. There's so many classes I want to take, and I always say I'm going to, and then don't get to it, unfortunately. Okay, so speaking of the faculty, it's important to know. So you'll get these slides and they're linked to their faculty profile pages, except Kelly is new and I don't have one for her yet. But it's important to understand the backgrounds where are they working now? Are they in the coaching field? Things of that nature. So super important we want to at least give you the opportunity to do that research yourself. Okay, Christina, I'll turn it over to you.
Thanks, Dr. O'Neill. So I'm here to talk about the application process. And please know that if you have specific questions related to your specific situation, please don't hesitate to reach out to me. I'm happy to go through and even walk you through the application process step by step. So an important date to keep in mind is our application for fall of 2025 is April 15th, tax day. Should be a busy day. As part of the application process for both the MA and the certificate, they're slightly similar. So the MA program, we do require students to have experience with prerequisites in human physiology and general psychology. As long as you've completed those courses and they show up on an academic transcript with a B minus or better, we will accept them. If you're leaning towards wanting to just get a refresher on that information, or if you do need to take those courses, I have a list of courses that I will send in our follow-up email that are great recommendations that other students have taken. We will also ask, as part of the online application, that there's 3 letters of recommendation, and we will ask them to be professional references. Those can be anywhere from an academic advisor if you're newly out of undergrad, if you have any group work that someone can talk about why you're a great fit for this program, even volunteer work are great letters of references. We will also ask that you indicate any scholarship needs that you have for the program. We will also ask for all copies of your college transcripts. At the time that you apply, they do not need to be official transcripts, so no need to pay for official copies. However, if you are admitted into the program, the graduate school will require official copies as official process of their review. And then lastly, the GRE is not required for our program. The next slide, please. The steps for the application are also listed on the very bottom of this slide because the university uses a similar application for all graduate programs. The list of steps on our website are specific to our program, so no need to complete anything outside of what's needed for us. To wrap up the application, we will ask for 2 different pieces. A personal statement, where we will ask for your hopes and expectations that you have for the master's program. So about 2 to 4 pages double-spaced. We will also ask for a diversity statement, and we want to understand what your appreciation of equity, inclusion, diversity, and belonging, why is that important to health coaching? And then also, how might you contribute to making society a more equitable and inclusive place? The last part of the application process is an interview. And if you are selected after the review committee looks at all of your materials, you'll be contacted via email by me for an invitation to interview. And then, while all of this information that we've talked about today is important, this is a huge investment in your future. So we do want to make sure that we talk about what the cost is and what kind of investment you're looking at. So for 2024-2025, the tuition rate is about $9,600 per semester. And as Dr. O'Neill mentioned, the university institute what's called a banded tuition. What this means is that you are charged the same tuition for the semester if you take 6 credits or if you take 14 credits. So those list of electives that Dr. O'Neill was mentioning, this is a great opportunity to add in a Reiki, maybe a yoga certification, or a nature-based therapeutic course where you can get a little bit more knowledge. So if you're kind of following along, about $9,600 for 4 semesters, you're looking at a total of about $40,000 to $45,000. Keep in mind that this is just the tuition. This doesn't include any course fees or any textbooks, which you can get from those links at the bottom there. So with that was a lot of information. We want to use this time now to answer any questions you have.